and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith, and today I'm here with Dr. Peter Voros. Dr. Voros, your role with the COVID-19 Incident Management Team is Operations Section Head. What is the scope of the responsibility for that?
Yeah, that's a great question. I think after 8 or 9 weeks, I'm still trying to figure that out. As you know, switching to an IMS system has been a bit of an adjustment for all of us. So the operations head is really responsible for rolling out anything and everything. So the way the system works is anything that needs to change in the system is created through planning, and then the plan is handed over to operations, and we bear the responsibility to enact that plan. And that may mean giving pieces to logistics, which would look at resources and equipment, or to communications to yourself and your team, and then any other thing that's related to kind of rolling out the plan sits within operations. So pretty much anything that we create through the IMS ends up coming over to operations to roll out.
So can you give an example of a project?
Sure. Probably the first two big ones we took on was the creation of the assessment center and the screening tables and controlling the movement of visitors and staff coming into the building to making sure that they were screened. So the planning team determines the plan for the creation of the assessment center. Let's stick with that one. Hands it over to operations, and then we're responsible to make sure it gets up and running. So we bring in logistics for the equipment and staffing needs, communications to make sure that the public and staff all know how it's going to work, actually set it up, staff it, and get it running. And then any changes that need to happen in the assessment center are part of the operations.
So you must be working with a very large team.
It's very big.
Who is on it in terms of the types of roles?
Yeah, so who's on it has really changed over the 8 weeks. As you know, the IMS system kind of grows and shrinks as needed. So we started with a core group of 2 or 3 people, a clinical branch and a support branch, and a screening branch. It's kind of expanded to include other pieces and then contracted as we need. I think right now we've got 5 key leads underneath the head, and each of them has leads underneath them that do different pieces of work depending on what needs to happen.
It sounds really complex. What does a typical day look like?
Sure. So a typical day today is a little bit different than it was, say, 4 weeks ago when we were right at the beginning of all of this. In the beginning, our days started pretty early. We would start off preparing for an 8:30 IMS meeting, so looking at what our focus was going to be for the day, needing to report on anything that's happened overnight, an update on all the projects that were moving quite quickly. We would have an 8:30 IMS meeting, and each of the teams in IMS would do a full report on where they were with their projects. Following the IMS meeting, we would have our operations meeting. So I would meet with my operations team to get updates from all of the people in operations in terms of their projects. What were they doing for the day? What did they need approval for? What were the barriers they were facing? Who else did they need help from? Following that, there would be another meeting. I'm guessing the days are all meetings, and you know that, with operations and planning to do our handover of things from planning to operations. Mid part of the day typically has been reviewing documents, approving proposals, meeting with groups to determine what resources we need, what needs to roll out today, tomorrow, how things are going to change, reviewing government documents in terms of what's changed in terms of requirements and screening, all in preparation for a 4 o'clock IMS meeting. So we meet twice a day. And in the beginning, those meetings were pretty intense. They were 2 to 3 hours every day, 4 till 6 or 7, with a lot of decisions being made, a lot of discussion, a lot of arguing, friendly arguing around what the needs were, where the needs needed to be, where staff needed to be. Things have gotten to a point now where we're still having 2 meetings a day, but they tend to be briefer. They tend to be updates as most of our projects are kind of in full operation. We still have a few pieces that we're working on, and now we'll start looking at what does that mean for the summer as we keep things moving and look at how do we improve things and make sure we're prepared if there's a second wave.
So you've talked a little bit about the changes that you've seen over the course of the weeks. What would you say are the most significant changes from the operations section perspective that you've seen in the 8 or so weeks that we've been active?
Yeah, probably the biggest changes relate to the biggest projects. So the assessment center, screening, the decreasing of visitors to care partners and then care partners to essential partners, the flow of patients through the building, moving from not allowing patients to flow through the building, the creation of a 3A COVID unit, which is today as well changing, and the creation of the ED into a higher risk and lower risk zone. Those are pretty big projects that have been kind of the key work of operations over the last 8 weeks.
So when we are not dealing with a global pandemic, you are normally the Executive Vice President of Inpatient Programs. How do you manage that and be the pandemic incident management team's operations section head at the same time?
Yeah, I mean, I think I manage it like everybody else. We're still running a hospital. We still have work to do. Our frontline staff and our managers and directors are all doing their jobs. There are key initiatives that we had been working on and moving forward that have paused momentarily, some of our bigger projects. As the ministry puts a pause button on moving things forward, so were we able to, so that we could focus on the pandemic. But by and large, the work that is the day-to-day work is really done by our frontline staff and our managers. So they've continued that, I think, as many of the directors and VPs have kind of shifted their eye a little bit to dealing with the pandemic that's in front of them. And where we are now is seeing that we're needing to put our eyes back a little bit more to some of the day-to-day operations, and looking at some of the projects that we've left piling up on our desks.
Well, how will you apply some of what you're learning through the incident management system and this pandemic situation to inpatient programs?
Yeah, it feels like a job interview, Tracie. So it's interesting. I think one of the things that struck all of us the most going through this pandemic and the IMS system was how, when we focused, we were able to achieve so much so quickly. And I think that's something as an organization we've talked about for a while. And certainly our management team has said, you're expecting us to do a million different things. Can we decrease that a little bit? And I think what we've seen is when we do decrease and put some focus to things, we can actually accomplish a lot more quickly. And I think that's a lesson that we'll bring forward, that focus really is quite helpful in terms of achieving targets that we set out. So we'll be able to bring that forward. The other thing is probably not going to be very well liked, but we've reached a point where when we need something, we've seen through IMS that we can have it in hours as opposed to days, and I'm a little worried that we're going to carry that with us a little bit in terms of, what do you mean that's going to take a week? You got 3 hours, get it back to me. So we'll have to try to put our brains back to realize that in normal life we're not operating on that fast pace quite so much, and so it'll take us a few steps back to kind of slow things down a little bit.
Right, yes, we've certainly adapted our response time, haven't we? What have you been most proud of regarding the way our hospital has been responding to the COVID-19 pandemic?
Yeah, that's an easy one. The staff, and by staff, I mean our staff, our professional staff, our managers, our directors, our senior team, the willingness of everybody to step up and do everything and anything that needed to be done. And it didn't matter who you were or what your role was. People were rolling up their sleeves and digging in to help. And the flexibility that they demonstrated in terms of their ability to just change on a dime. As you know, through this process, information changes hour to hour in terms of what we're given. And sometimes we're full steam ahead on a project and having to stop, turn, and move in a different direction. And the staff, all staff's ability to do that and to be nimble and flexible has been truly incredible to see. I think the other thing is I've always felt like we have such incredibly strong teams in this organization, but this has really demonstrated the strengths of those teams. The ability of these groups of people to work together, not always agreeing, but to work together to get the work done and come to a common consensus decision has been truly remarkable. And so I think the strength of those teams and their flexibility and nimbleness will continue with us and make us a better organization as we move forward.
It's brought out the best in most of us, I think.
Yeah.
And
I've had a few bad moments, but mostly the best.
Well, I think your leadership as the operations head has a lot to do with that. You have a very calm approach.
Most days.
Most days. I think we've all had our moments.
Well, and I actually think it's an important thing for people to keep in mind that, what this has really demonstrated is, we're all professionals and we all work professionally, but this has been a very stressful time for everybody. And when we're under stress, we can react in ways we wouldn't normally, myself included. And I had a few moments of losing my temper a little bit, and you make your apologies and you move forward. And we've, through our IMS system, have, as you know, have said IMS has no feelings. You have to just kind of move forward and keep going. But it really demonstrated that in a strong, psychologically safe team, it's okay for someone to feel stressed out and to lose it a little bit, and the team will support them through it and be okay on the other side.
Well, your psychology background has helped a lot. The entire team has benefited from that. So what are you looking forward to the most when this is all over?
You mean other than a day off, that we won't be able to travel and being able to golf? It's interesting because we're talking a lot about the new normal, and I think we will not be returning to the world as we once knew it. Certainly in healthcare, things are going to be different. How we interact with each other, how we interact with our patients, how many patients we have in a space, how many staff we have in a space. I think these things are going to change forever. And so I'm actually looking forward to being able to be part of developing what that new normal looks like for us and the creativity that comes with that. I think one of the huge things we've seen through this whole process, we have incredibly creative staff and leaders who are finding solutions that we didn't think were possible. And so, creating that new normal with staff who can think about how to do business differently and giving them the freedom and flexibility to do that is something I'm really looking forward to.
That's the silver lining. There's a lot of opportunity ahead of us. Absolutely. Do you want to leave the community with a particular message about what's happening right now?
Absolutely. So I think one of the things we need to feel proud of in Northwestern Ontario is who we have been as a community through this. So we are looking every day at the predictions and the charts and the graphs, and it's pretty clear. You've been hearing in the news for the last 2 months about flattening the curve. We've done a very good job of that in Thunder Bay. And I think the community needs to feel very proud of themselves that they've done this, that they've challenged each other to stay home, to stay apart, to stay safe. I think the community has to realize as we start to open the doors a little bit in this community, we can't let up on that. We need to continue with physically distancing. We need to continue with safe practices and washing our hands and covering our mouths if we're not able to maintain 2 meters of distance. It will be really important as this community opens up for all of us to not let up on that. I guess the other piece is remembering that we are a healthcare facility and we are here for the community. One of the things we're seeing across the country is that through this pandemic, people who are having health difficulties are not always coming forward. So people who are having heart issues or even broken bones are not coming forward. They need to. We need to continue to take care of the health needs of our community. And I know people were nervous to come out and come to the hospital, but if they need health care, they should be contacting their doctor or coming to the hospital because we need to care for them. And that's what we're here for.
Great point and very important message. Dr. Voros, thank you so much for joining us today. We'll see you again soon.
Thanks, Tracie.